Hello everyone, this is Wilson Damiani Asib and I am the community health advocate in Africa, but more especially in Malawi. I am also the national coordinator for the Malawi network of community health workers. I just want to share with you a story, a very painful story that I drew a painful lesson from. I traveled with my family to one of the rural areas in Malawi. It was a very beautiful day. I traveled with my wife and my two children. The first one is Omega and the other one is Ariana. Very beautiful girls and their mother. We left our home and traveled to this local area with all jubilation, expectation, joy in our hearts. And we reached there, we had a local meal. It was wonderful. We had, the night fires there, and also we had an opportunity to eat local delicacies there. And then after everything, after feasting, after enjoying our vacation, then we want to have a rest. It was night, I think it was around 9 when we went to rest. And what I did not tell you is that Ariana is not even 1 year old. She's now 6 months. 6 months. Whilst Omega, my first daughter, is 4 years. So then, when we slept, it was quiet. It was wonderful. It was raining as well. And then I just realized that my wife was shaking badly. My wife was coughing. My wife seemed to be very sick. But then I also realized that my 6 months daughter is very sick, coughing again as well, and shivering, and her body temperature has just soared. I was in a panic. We tried this, and nothing seemed to work. And I couldn't sleep. I didn't know what to do then. That grip of fear, that apprehension, that anything may happen, and we were in the thickets of middle of nowhere. And to travel even to the nearest health center, it was far away then, and we didn't have any mode of transport to run fast and to find these health services that we required most. That fear that grips you during the night, that you can't sleep, and see a coughing of my wife and the coughing of my 6 months daughter, and see I had no way of dealing with that situation, that fear that gripped me. And I think it was early in the morning that I worked out a plan to find a means of transport to move away and to go and seek medical attention. And fortunately, we had money on us. Fortunately, we had to connect to our colleagues that were far away so that they can come with a vehicle and to take my children that were not feeling okay, and my wife. I feared even death could happen then. And then that moment, I think it was 4 a.m. that they came to pick us up, and we rushed, to a close by private healthy facility, and then there, fortunately, they were helped, but my wife couldn't walk. My child was like, it was just a terrible situation. It was a catastrophic, a situation. And then we went there, and they ran some tests, and they helped them, and the bill was just so huge. And then, fortunately, now they are fine. They are back to normal. Everything is in order. But when this happened, I thought of a poor woman that lives in a poor community, like where I went, has no mode of transport, has no money even to look for even a car, even to look for any form of transportation to go to the nearest health facility. And in Malawi, most of these community health facilities are sometimes 15 kilometers away. Just think of the mental torture that woman goes through, that even in the middle of the night she can do nothing. And if that illness is terminal, that child will die. That woman will die. Just think about that. I learned a bitter lesson. That once we are comfortable, once we are able to go and seek medical help, when maybe health centers are close by, when we are able to fish out money from our pockets and pay at a private clinic, we should know that there are others that do not have private clinics close by, that do not even have money even to pay, that do not even have transport or mode of moving from one place to the nearest clinic of a health facility or private hospital to drugstores. They are in the thickets of the bush. They are in communities that are far away from even in main tarmac roads. And sometimes bridges are washed away. Sometimes the rivers are full. They can't cross to go to the other side. That even ambulances can't move, can't cross and reach out to those people. The only hope for these people are community health workers that are well trained, that are well remunerated, that are given the medical supplies, that have drugs, that knows what they are doing, that lives close to such communities. As a community health advocate, I realize that most deaths that we are seeing in rural communities is because of lacking of community health services. And by the way, there's no way we should put away community health services from the communities. These communities need community health workers that are well trained, well equipped, well resourced, well motivated, that have drugs, that have supplies, and that have even phones. Most of these community health workers do not even have phones that even the communities can call them, can summon them if they have a difficult situation. But communities can run even to these community health workers, and the community health workers do not have even the drugs, do not have the capacity to address even some minor health challenges. This is why we need to do something. It is easy when we can just move from here 3 kilometers by car and get the services you want, and maybe 500 meters and you have your health services, and maybe you find drugstores that are close by and you have money to pay. But we are talking about poor communities that are poor, families that are poor, families that do not have electricity in their homes, families that do not even have a mode of transport, families that are struggling already to feed their children. And where can they get money? Where can they have access? Some of these roads are bad already. There are no good access roads to markets and to health centers, and they are left with ill-equipped, ill-trained, under-resourced, unmotivated community health workers. And in most most communities in Malawi do not even have community health workers. They are on their own. They don't know what to do. Invest in community health. You save lives. There are many other areas we are seeing donors and support institutions and sponsors are supporting football and many other, areas that need support. But I would say life is the most important and fundamental human right. We need to protect the lives of people. All other rights do not matter if the right to life is not safeguarded. And health protects this right. Access to health services for rural communities is vital. Is also a safeguard of a human right, the right to life. Let's support. I saw myself. I fear it. I worried over my family. I worried over my daughter, Ariane. I worried over my wife. They are alive today because to some extent I had the capacity to help myself. What of those women, grannies that are keeping orphan children? How can they access such services that are sometimes 15 kilometers, 20 kilometers away? There are no healthy community health workers. Governments, wake up. It's time to invest adequately in community health. Parliamentarians, pass bills that ensure adequate investment in community health. Ensure that we recruit enough community health workers. Even in Malawi, right now we have a deficit of 7,000 community health workers for community health services to be effective in this country. We have many community health workers that are not even trained at all. Some of them, they just received 1 month training. How can they really address the myriad of community health challenges that our country is facing if they are ill-trained? If they do not have drugs, if they do not have medical supplies, if they do not have refresher training. Some of them, they were just trained 2 months and 5 years has passed, 7 years has passed, no any refresher training. And yet we have new cases coming in, new developments in the medical field. We need refresher trainings for community health workers. We need refresher trainings for HSS, health service surveillance assistants, and even the seniors, midwives, community nurses. We need to empower them. We need to train them. But most important, we need to remunerate them, and we need them to give them adequate resources, adequate compensation. Some of them are overworked. They are overworked. Sometimes they are forced to do the things that they are not trained for. We need to invest. Donors, it's time we pool resources and invest in community health. It's time that we build community health posts. It's time we build community health centers. It's time that we bring in ambulances. It's time we bring in even mobile clinics. It's time that we equip and resource community health workers. It's time we bring health to where it is needed most. That's where 84% of people in Malawi lives. 12 point something million people where they live. That's where health services should go. So I implore each and every one of us to stand and support community health. My name is Wilson Damian Asip, and I'm the National Coordinator for the Malawi Network of Community Health Workers. And my number is +265 994 211 698. Again, +265 994 211 698. It is also on WhatsApp. And reach out to us if you want to support community health in Malawi, if you want to support community health workers, And if you want to learn more how best you can support community health in Malawi and save lives, you have an opportunity. We are giving you an opportunity to save lives, to save the lives of mothers, save the lives of children that are full of potential, save lives of young people, young women that are full of potential that may be dead in the next 2 weeks if you can't support because of lack of effective and adequate community health services. It's time to strengthen community health services. It's time, parliamentarians, you pass bills that ensure remuneration of community health workers, that ensures the recruitment of community health workers, that ensure resourcing of community health workers, that ensure that the conditions of community health workers are favorable so that they can subsequently serve the communities they love and they serve. You know they are passionate to serve this community because it's where they come from. Some of the people that may get sick are people that have gone to school with. They are their cousins, they are their brothers, they are their fathers, they are their mothers, they are their grannies, they are their children, they are their wives, they are their husbands. So they are willing to give the best service they can because they are saving their life. Like I rushed myself to the hospital. I looked for ways to save my family. They are just looking for ways to save their family, but they can't save their families, they can't save their communities without drugs, without the skills, without the competencies, without, giving them, motivation. Because as they are working with communities, they don't have time to go to the fields. They don't have time to go and work or do businesses. They are busy serving their community. Where will they get food for themselves, for their families? So it's when the community health workers are remunerated. You can't expect that the whole day the community health worker will be serving the community and at the same time should be looking at where to get the money for their food and so on and so forth. So we implore you, we ask you to support community health in Malawi and support community health workers. Thank you. You have been with me, Wilson Damian Asip. I am the community health advocate in Africa and also in Malawi. Thank you.